While you are becoming familiar with this sequence, pause the video to practice each activity. Eventually, you will not need this video in order to do this sequence. The approach to these mobility sequences is to demonstrate activities that can be done throughout the day. The more you can find ways to incorporate this sequence into your daily life, the more benefit you will find. Fitness is a daily lifestyle that can be improved with small steps throughout the day. 4-7-8 breathing. Use this breathing method as a relaxation technique or as a way of timing your stretching. That means using 4-7-8 breathing to determine how long you hold the stretches in many of my videos. One cycle of 4-7-8 breathing consists of inhale through your nose for a count of 4, hold your breath for a count of 7, exhale out of your mouth for a count of 8. For relaxation, start with 5 cycles every hour and increase as you gain experience. For my mobility sequences, determine how many of the cycles per stretch, and that is how long you hold each stretch. The posterior chain is a collection of interconnected muscles and the overlying tissue called fascia that connect the feet to the head. They can start from the plantar fascia, the bottom of the feet, go up through the calf muscles, hamstrings, into the gluteus maximus, up the spinal muscles, into the back of the head. Two other muscles, the diaphragm and the latissimus dorsi, also play a critical role in influencing the function of the posterior chain, which helps with all spinal movements. This set of sequences helps encourage posterior chain mobility throughout the entire spine. We start off with a tennis ball or any other ball that has some type of compressibility but has firmness. And you spend a minute massaging the foot back and forth. After that minute, you drop the heel, stretch the calf, and take one hand and stretch the upper part of the neck. Just pull the head forward to the point of mild discomfort and a slight stretch, and hold that for another minute, and then we repeat to the other side. Here I demonstrate it from a different angle. I do recommend 1 minute on each foot and 1 minute for each stretch, for a total of at least 4 minutes. Next, we move on to the latissimus dorsi muscle. This attaches to the upper arm and extends all the way down to the low back. You're going to place your palms and the forearms on a counter or a table, then slowly walk backwards till you get to the point where your back is pretty flat. Then you start bending your knees up and down. It is important to try to get your feet as far back as possible, but keep half your forearm and your palms on the table. I'll demonstrate it one more time. Remember, you want to keep your palms and at least half your forearm on the table and step back as far as you can and try to get your back as flat as possible. I like bending the knees as it's like flossing the tissues, allowing to stretch and relax, stretch, relax. But you can also find benefit holding it for about a minute or two. Next, we proceed to the diaphragm stretch. While you're sitting comfortably in a chair, take your fingers and gently curl them underneath your ribs, pressing upwards to get a little bit of a stretch underneath the ribs, but not to the point of discomfort or difficulty breathing. I recommend 10 breaths into the fingers at least. Finally, we do thoracic mobility, leaning backwards against the back of the chair. If you can't get your hands over your head, use your hands against your lap and gently push backwards. And here I demonstrate it from a different angle. 10 breaths into the diaphragms, and then for the leaning backwards over the chair, 10 back and forths, and then hold that backward stretch for a minute. Beginning with the diaphragm stretch, gently wrap your fingers below your rib cage, pressing gently upwards, and then breathing in and out 10 times into your fingers. Next, to work the deep spinal muscles, do lumbar flattening, where you're gently tilting your hips upward and downward, trying to get your lumbars, which is your lower back, to touch the floor. Start off with 10 lumbar flattening motions. Then we're going to straighten our legs and we're going to stretch out the hips. Begin by bringing the right knee to the chest and hold it for at least one breathing cycle. Then you'll switch to bring your left knee to your chest and hold that for at least one breathing cycle. Next, we proceed to stretch out the lumbars, and you can do it this manner, crossing one ankle over the knee and stretching, or you can just let both knees fall to the side without crossing the ankles. Again, holding each stretch for at least one breathing cycle. Or you can reach your foot outward across the floor as shown in the insert. Now we switch sides. Bring the right hip and the right knee over the left side. Place your foot behind your knee, in front of your knee, or as the insert shows, reach your right foot out in front. Hold this for 30 seconds. Hip flexor stretch. Now roll onto your side. We're going to stretch out the top leg. Drop the top foot behind you, as shown, as far back as possible. And if you're doing this on a bed, you can drop your foot off the side of your bed. And drop your top shoulder behind you in order to straighten out your upper back. I can also move my bottom foot forward a little bit to increase the stretch as well as improve my balance. And if I can, I'll reach back and grab my ankle and pull a little bit harder to increase the stretch. Next, we proceed to do diaphragm stretching, where you just take your fingers and gently press into your diaphragm underneath your ribs. Now don't hold this for a breathing cycle, but rather do 10 breaths into your fingers. The deeper you inhale and exhale, the greater the stretch you'll get. Then we finish up with lumbar flattening. Again, do at least 10 rocking back and forth. While you are becoming familiar with this sequence, pause the video to practice each activity. Eventually, you will not need this video in order to do this sequence. The approach to these mobility sequences is to demonstrate activities that can be done throughout the day. The more you can find ways to incorporate this sequence into your daily life, the more benefit you will find. Fitness is a daily lifestyle that can be improved with small steps throughout the day.